Good morning, everybody, and welcome back to Ordemy. I know we took a little bit of a sabbatical here, but I'm happy to see everybody's in good health and life is moving back to our new normal. Today I'm going to start off with teaching you extraoral exam. I'm going to ease you into the curriculum because I know a lot of you are still babysitting your kids at home. We're going to go slowly but surely. But I wanted to get started this weekend because we've had a long lag. We're starting with something small and we're starting with something easy. All right? So today we're going to talk about extraoral examination. And this is a very important part of our exam. When a patient comes into the office, say Mr. Joe's coming into the office, what's the first thing we do? We greet the patient. Hi, Mr. Joe, come on inside. And then we do a blood pressure on the patient. We do a complete exam, extraoral, and an intraoral exam. The intraoral exam is going to be covered by Dr. Cross. He's our new faculty. Welcome him aboard. He is actually teaching from Southern California. Many, many years of experience. You're going to enjoy meeting him. But I'm going to be talking to you about extraoral exam today. When a patient comes in, the first thing we do is take a medical history. And the medical history and the dental history is the most important part of understanding the patient's past. You want to know everything that's going on with their health, especially if you want to do something like comprehensive general dentistry, or if you want to place implants on them. It becomes crucial to understand what drugs they are on. Do they have any underlying health conditions that's going to impact your treatment? After you've taken a medical history and your doctor has studied the medical history, the doctor and the assistant, the RDA, the RDAEF, is going to move on into the extraoral exam. The extraoral exam becomes of prime importance because you're trying to see if there's anything that catches your eye that's out of the normal. So we're going to go over these slides one by one, and I'm also going to share some personal experiences with you. So there's going to be a little bit of storytelling. Sound dental care, as I said, belongs, we have to do a head and neck exam as well as oral cavity exam. The most important part is the medical and dental history, after which we move on to the extraoral and the intraoral exam. After which, your dentist is going to ask you to take FMX, panoramic, and these days a CT scan. Now, study models these days are digital or your old-fashioned alternate models, which is also an important part of understanding occlusion, how the patient is biting down, what teeth are missing, and what is our plan going forward. Then we discuss the treatment plan with the patient. We tell them what we found, we tell them what we think, and we come up with a comprehensive plan. And of course, we talk about the dollars and the cents. After the patient has agreed and accepted everything you have told them, you then move into treatment. So let's move to the second part. As I said, you're going to first seat the patient. You're going to take some vital signs. You're going to record on your chart, which is either a digital chart or a paper chart, depending on who you work for and how high-tech they are. Then you're going to be taking intraoral and extraoral radiographs, preliminary impressions to fabricate the diagnostic models. Pictures are a very, very important part of your diagnosis. Not only do you want to take intraoral pictures with an intraoral camera, but you also want to take extraoral pictures. Pictures have a very, very high weightage, especially on the legal side of things. If anything goes wrong in your treatment, the first thing they look at in court is your pictures. Pictures speak louder than 1,000 words. That is right. Organize the patient's record, and then you prepare for the case presentation. Now, there are certain skills that you need to hone into, especially when you're doing an extraoral exam. Because we're so busy in our everyday life, sometimes we tend to miss a few things. And that is the goal of this lecture, where we're going to be talking about looking for minor little things. For example, direct observation, where you're looking at the patient with your eyes, right? What is the first thing you look at? The patient's face, the patient's gait. How is the patient's body? Is there one side a little bit off? Is there a slight hunch? Does the patient have some scoliosis? So these are the things that first come in front of you when you look at the patient. Body symmetry, especially in orthodontics. Oftentimes you'll find even some celebrities have a chin slightly a little bit off. Why is that important? It's important because their midlines are never going to be matching even after you complete orthodontic treatment. That is something you want to let them know up front, that if you want to shift the way your bite is or your jaw is, we may have to consider oral surgery. So understanding what is bringing the patient in. If the very first thing they tell you is, I don't like the way my jaw is angulated to my left. I don't like the symmetry of my face. You know that's something that we can fix with just orthodontics or general dentistry. That's something that's going to need a little bit more of the surgical intervention. Palpation, touch. So the first thing you're going to do is watch with your eyes. Second thing is you're going to touch. You're going to use your fingers. The art of touch is called palpation, where you use your fingers to touch and to diagnose. That tells you, is there something wrong? In the mouth, we use our fingers. You can also use your hands, and we're going to go into that in a bit. When you're touching, what are you feeling for? Is there any tenderness? Is there any change in texture? Is there a mass that you're feeling? Auscultation, what is that? You're using your ears to hear any abnormal sounds. What are you listening for? You're listening for TMJ crepitus, sounds that go in the TMJ joint. You're also looking for speech disorders. There was once a child who had an underlying speech disorder, and he was a little bit slow when he was speaking. But because we diagnosed that he had a speech disorder, the parents actually went to their general physician and they diagnosed him. He was mildly autistic. So a lot of things are found on the dental chair. I saw another child who had a tongue tie. So when the child was speaking, there are certain words that they couldn't say, just like this, thick, thin. Ask them to pull their tongue out. And sometimes they're not able to do these things because they have a tongue tie. And this tells you that there are certain things that can be diagnosed by just listening to the way the patient speaks. Vocal hoarseness. You will not believe this. Sometimes a patient will come to you with hoarseness in their voice, and the dentist will refer them to their physician. And they find sometimes cancer of the larynx. Again, this is first caught on the dental chair. So listen, touch, visualize, and be alert. Olfaction, smell. Sometimes the patient will complain to you that they have odor, very bad odor, otherwise called halitosis. That could be a sign of the patient being diabetic because they have a ketone breath. If any of you have tried the ketone diet, like I have, you'll know in week 2 or 3, your breath begins to smell of ketones. And that also tells you that you're getting into ketosis. So if a patient is not dieting and they have this ketone breath, it tells you that they might be diabetic. Or they might just have a lot of bacteria in the mouth. They might have heavy calculus. They haven't had a cleaning for a long time. And they may have a mouthful of caries. So this is something else you want to look for. All right, moving on. As I said, the most important thing is the overall assessment of the patient. So once you have done the extraoral, the intraoral exam, we're doing this so that we can come up with a comprehensive plan. So when we break down the visual examination, we break it down into different parts, just so that you don't miss anything. We start with the face, we move on to the lymph nodes, we go to the lips, soft tissue within the mouth, the tongue, the tooth structure, restorations, and missing teeth. So this is the order we generally follow. I'm going to be covering the face, lymph nodes, and lips, and the rest of it is going to be covered by Dr. Cross in the next lecture. Palpation, like I mentioned, we use our fingers a lot in dentistry. The art and science of diagnosis using your fingers is called palpation. The examiner uses his or her fingers and hands to feel for texture, feel for size, feel for consistency of hard and soft tissue. This technique is especially useful for detecting any swelling that the patient might have and is the primary way of detecting swollen lymph nodes. The most important thing, especially with COVID going on, you want to definitely check if the patient has a mild fever. Sometimes they don't have a fever, but they have a swollen lymph node. You want to use your fingers and check if there is any inflammation. If the body is fighting any virus or bacteria, the first thing that happens is the lymph nodes swell up. And I'm going to show you where the different lymph nodes are so that you understand. Observations. Abnormalities should be documented, of course, in writing. You just don't want to see something and not document it. Documentation is also going to be as detailed as what is the shape, the location, the size of the lesion. Is it tender? Is it non-tender? Is it movable? So those are the things that you want to take into consideration. Head, neck, and face. Observe the symmetry of the skin, the eyes, the nose, the ears. Look for any unusual discoloration. Discoloration is also an important part of COVID. A lot of COVID patients are finding that they're having redness of the eye and loss of sensation, the taste sensation, and smell. So this is a very important thing you want to check for. Also, a lot of them are coming in with red rash-like lesions on their body because they have small rupture of blood vessels. So that becomes a very important part to catch asymptomatic cases. The color of the skin is very important. Why? If you have any systemic problem going on, especially with your liver, if you have jaundice, your skin color changes. If you're anemic, your skin color changes. So your skin color tells you a lot about are you in good physical health. Erythema. I just told you COVID patients these days have a little bit of redness. The word redness is called erythema. Erythema tells you that there's something underlying going on. It could be rupture of blood vessels. It could be an inflammation that's going on. It could be a rash. It could be an insect bite that causes erythema. So that's something you want to look out for. You also want to look for any swelling, any scarring, moles, freckles. Why are moles important? You'll be surprised. A lot of people get basal cell carcinoma from exposure to the sun. The UV light of the sun causes people to get small moles on their face, which actually turn out to be carcinogenic. And guess who's the first person that catches that? It's you, the RDA. The RDA has often told the dentist, I see something funny on the skin. And then we refer the patient to the dermatologist. Lo and behold, we have just caught a patient in an initial stage of basal cell skin cancer. So that's why it's very important to look for any kind of lesions. Look for the color, the shape, the surface texture. Sometimes you have to use a periodontal probe to actually measure how long or how deep or how wide a lesion is. So your documentation has to be 100%. Moving on to the next. Now, looking at extraoral examination, as I mentioned to you, that we first start off with the face. You can see a picture of the girl there. She has some redness on her skin. That is called erythema. With COVID, you're beginning to see redness on the neck. You're beginning to see redness also on the abdomen and sometimes on the back. So you want to ask the patient if they have redness anywhere else in the body. Also, you want to look at the eyes. As you can see, the person in the picture there, his eyes are yellowish. So you know that there's something going on in terms of, maybe this particular patient has jaundice. So you may want to refer them to their healthcare physician who run a blood panel. That'll actually tell you what is wrong with their enzymes in the liver. Sometimes you can catch a lot of hepatitis patients in this manner. Now, lesions should be measured, documented down to details of color, size, shape, surface texture. A periodontal probe may be used to measure. Now, you can see the difference, a person who's normal versus a person who has jaundice. There's slight yellowing of the skin, and that is usually because of abnormalities of the gallbladder. There could be a stone in the gallbladder that is causing backup of the bile, and hence it's causing the eyes to become yellow. So a lot of things can be found out by just looking at the patient. Isn't that amazing? All right, now they say that the window of looking into a person's soul is through their eyes. So let's look at the eyes. Now, sometimes you can notice that a patient cannot see properly. And why is that important? If they cannot see properly, sometimes when they brush, they will not be able to see where there's plaque, what they need to do. There might be some visual impairment. So you have to note these things in the chart, like are they partially blind? Do they need somebody to help them with some things? Pupils. I'll tell you a funny story. I was working in Concord, California many years ago, almost 10 years ago now. Time flies. And I had a boy, but I think 18 years old, a braces patient who came to see me. And, he had just smoked some marijuana that morning. And his pupils were dilated. And, you get that smell sometimes when the patients come in. I was like, why are his eyes so dilated? So that is a little sign if somebody is on any kind of drugs. Are they on, smoking weed before they come into the appointment? So these are things that you can look for in your pupils. If they're dilated, you know that the patient has, some kind of an intoxication or an agent in the body that does that. Sclera is the fibrous outer protective layer of the eye. That's the white portion. You want to look for what looks like normal. Look at yourself in the mirror. Yellow or red. Red has started becoming very important, especially with COVID patients. They're finding that redness of the sclera is one of the signs that a patient might have COVID. So you want to keep in mind that. Asymmetry. I'm sure you guys have watched celebrities and you often notice, oh, his chin is a little bit off. That's what I mean by asymmetry. But you also notice sometimes a patient comes in and they have a slight droop right here. This goes this way. That happens when you have Bell's palsy. What is Bell's palsy? It is injury to the facial nerve. And how does that happen? In excess situations of stress, like what we all went through during the COVID time, sometimes the facial nerve gets affected, especially when it's extremely cold. In the December time frame, you'll often find patients coming in who were extremely stressed, who are going through maybe just a tough time in life. Sometimes you'll see that there's a little bit of a droop. You also have a droop when a patient gets a stroke. When a patient gets a stroke, usually the opposite side of the body gets affected. So you want to watch for these things because if a patient gets a stroke, they may not be able to maintain good hygiene because they're paralyzed or partially paralyzed on one side. So these are signs that also you'll see a droopy eyelid. You'll begin to see that the tears on that side don't come out. You'll see a facial paralysis, twitching. You'll see like their nerves twitching sometimes. You'll see also impaired taste. So these are the things you want to watch for. And sometimes, you often catch abuse. You'll see a patient might have, a hand imprint here. I had a patient in New York. I saw that both sides she had, somebody had held her neck. And it becomes our responsibility to report everything we see because you might just be saving somebody's life. So you want to watch for all these little things, especially, can they swallow? Are their hands shaking? Do they have Parkinson's disease? We already went through this, so I'm going to let you read this on your own. Now, nose. Oftentimes you'll see sometimes patients have a flared nostrils. Sometimes it's just normal that they have flared nostrils, but oftentimes in children these days when they have adenoids, and for those of you who have kids, you might notice that if a child can't breathe properly, oftentimes over a period of time, their nostrils get more flared out because it's a biological adaptation for the nose to flare out a little bit more because the child is finding it hard to breathe. So that's something else also as an orthodontist I notice is when the child comes in, sometimes you'll see that they're mouth breathers. They're sitting on the chair like this. I look inside their mouth and I find they have a very high arched palate. If I ask them to close their mouth and breathe through their nostril, they cannot breathe. What does that mean? It's telling me that they have adenoids. And if they have adenoids, the first thing we want to do is send them to the physician, make sure that their adenoids are in check, they don't have any polyps, they don't have any nasal septal defects, and you want to then proceed with expanding the palate. All these things help correct oral breathing into nasal breathing. And most of these children have a problem focusing in school, or these days we call it ADD or ADHD. You'll be amazed that once you correct the breathing, the expansion of the palate, remove the polyps, how attentive this child becomes. So these are the things that we catch on the dental chair that can actually significantly improve the quality of life for the patient and the parent. You'll be surprised, 1 in 3 to 4 children today are on ADD and ADHD drugs. If you look at the health history, you'll find a lot of children these days are being hyper-medicated because they are restless, or the parents say that they're hyper. The truth is, it's just that their nasal breathing needs to be corrected. Hearing loss. These days it's very common that, as we get older, you'll see a lot of patients coming in with a small hearing aid. You want to make a note in the chart if the patient can't hear properly or they have a hearing aid, because you need to know how to alter your voice when you're talking to them, or you want to make sure that they can hear you. Also, with these days, with 3 kinds of PPEs and N95 masks, if your patient can't hear properly, you may want to write things down, because I don't think they like it when you scream into their face. Can you hear me? Sometimes it's much better to just write things down if they can't hear things, especially with your N95s and 3 types of PPEs on your face that you have today. You want to speak slowly, you want to write things down, give them written instructions, and you want to make sure that you're noticing their hearing aid and make a note in the chart. TMJ. I spoke to you a little bit about the sound in the TMJ. It's called crepitus. The one thing that we do when we do an extraoral exam is check the TMJ. Now, you'll be surprised that once you start looking at the TMJ and start paying attention to it, you'll see how many people have TMJ issues. These days, we give them a night guard because a lot of people are stressed out and are grinding. But to examine the TMJ, we use our fingers. We place our fingers on both sides. There's another technique of examining the TMJ where you wear gloves and you put your fingers inside the ear and ask the patient to open and close slowly, and you can actually hear the sounds at greater depth when you're inside the ear. That's one technique. The second technique is where you use your hands and you place your 2 fingers bilaterally, ask the patient to very slowly open their mouth. And you want to notice if there's any shift in the TMJ when the patient is closing the mouth. You also want to notice for jaw or mouth opening. The normal mouth opening is 3 fingers. If a patient cannot open 3 fingers, you know that there's a problem going on. Also, you know that when you perform dentistry, you're going to have a hard time. You may have to prop the mouth open. If a patient has crepitus, like you hear kind of sounds when you put your finger there, you know that the bone is rubbing against something that's creating the sound. Sometimes there's a pop. When a patient closes their jaw, it goes tuk, tuk. That's called a pop. Now, oftentimes the patient has no symptoms, they have no pain. Then what do? You just leave the patient alone. If the patient has symptoms, if they tell you I have a lot of pain, you want to first refer them to a TMJ specialist before you proceed with any general dentistry work. Because if the TMJ is not under control and you perform, extensive dentistry and crowns and orthodontics, you can land yourself in some deep doo-doo. So make sure that the TMJ is under control. These days, a lot of young patients in their 40s are coming to me with arthritis. Arthritis is inflammation of the joints. But the bad thing is, arthritis also affects the joints in your jaw joints. So what happens is, if there's inflammation there, it often eats up the cartilage. And these patients are in a lot of pain. They need Botox into the joint. They need splint therapy. And stress often exacerbates pain in their TMJ. So enough of me talking. Let's look at what your slide has to say. Your TM joint, as you guys know, is right here. And you have the bone, and then you have a cartilage. And then you have the upper portion of the bone. So it's kind of like a sandwich. It's 3 parts. As you can see, you have the disc, you have the mandible, and you have the temporal bone. So the soft disc or the cartilage is in between right there. So what are you looking for? You're looking for deviation, you're looking for pain, you're looking for crepitus, looking for grinding. Most people working in tech in Silicon Valley would have ground off a lot of their teeth. You want to make sure that you're diagnosing their grinding. You want to check their range of motion. You also want to check if, as I said, you want to take a patient interview, ask them if they have pain. You also may want to look for bilateral palpation. Opening, closing, you can use a stethoscope if you can't hear or you can't feel with your fingers. Oftentimes you can place a stethoscope to listen to the sounds that I told you about. You want to look for clicks, pops, and crepitus. Now, as I mentioned to you, by manual palpation, you also want to use your fingers to palpate the mandible, just like this. And by palpating the mandible, you're going to learn a lot. There are a lot of very important lymph nodes that are situated under the mandible and also on the side of your neck. And I'm going to teach you what these lymph nodes are. Now, right over here is your masseter muscle, and right here is your temporalis muscle. So when you clench, you can actually feel your masseter muscle. There are some patients who, when they come in, they're so stressed out, you can see that they're sitting on the chair and they're clenching their masseter and temporalis. Such kind of patients, you definitely have to give them a night guard, because if you do any crowns or implants on them without protecting their teeth, it's going to land up in failure of the restoration. It could be even a composite restoration. By just watching their muscles is going to tell you a lot about how stressed out a patient is. You also want to look for pain, swelling, unusual hardness. You want to look for bilateral circular compression. Have patient clench their teeth together for palpation so that you can see how strong the muscle is. Now, as I said, when you're using your fingers to touch, it's called palpation. What are you looking for? You're looking for any swellings in the joint. This over here is the parotid gland. The parotid gland produces saliva. Sometimes the parotid gland that's right here is swollen. You want to use your fingers and see, is there anything abnormal? Is there any swelling on one side of the face? You want to use your fingers under the line of the mandible. You also want to use your fingers right here under here. Then you want to use your fingers along the neckline right here. And behind here, the scalp right here. You also want to wear your gloves and put your fingers inside under the tongue and go sublingually to check if there are any lymph nodes over there. What are you looking for? You're looking for nodules. You're looking for any lesions up to 1 centimeter in diameter. You're looking for anything above the skin. You're looking for anything inside the skin or anything beneath the skin. 1 centimeter is equivalent to little less than ½ an inch. So you're looking at anything really that tiny. Okay, so we are going to be talking about the characteristics of the lesions. So when you look for a lesion, you want to see whether it's benign or malignant. The word benign means non-cancerous. So it looks a little bit different from the cancerous lesions. I'm going to tell you what the differences are But the only way to truly know if something is benign or cancerous is through a biopsy. And that's something we don't decide. We send the patient to their general physicians or a dermatologist. But I'm just going to show you that when you look for a lesion that's what you want to look for is the surface smooth or rough? Is it raised or flat? Is it irregular, round or oval? Is it firm? Is it hard or spongy? Is it moving freely or is it tied down under to the surface? All these things will help determine whether the lesion is moving more towards a benign lesion or a malignant lesion. Also tenderness. Does the patient feel any pain? Pain is actually good. It means it's an underlying infection. And infected lymph node. You want to make sure and see whether are there any lymph nodes that are inflamed. Are the lymph nodes firm? Are they tender? Are they enlarged? Are they warm? Are they movable? Are they bilateral? Are they unilateral? Is it on only one side? Does it feel like a swollen grape? Also, if it's just, did the patient just have an infection? So these are all the signs that the lymph node is kind of a fresh lymph node. Malignancies of lymph nodes. Now, as you know, lymph nodes are the gatekeepers or almost the guards of the body. But sometimes what happens is these guards also go out of control. And when these guards start proliferating like crazy or the cells go out of control, it's called cancer or malignancy. How do we diagnose whether a lymph node is benign, non-cancerous, or malignant, cancerous? The way you can tell is whether the lymph node is firm. Is the lymph node tender? Tender is good. That means it's an infection or an inflammation. Is it matted or is it stuck to each other? Is it fixed? Is it unilateral or is it bilateral? So these are things you want to look for. As I said, when you're palpating, you want to use your fingers or your digits or your hand or your thumb or a combination of the thumb and finger. The technique of palpation is just so that you can get access to whatever you're feeling. So based on that, it can be a digital use, a bidigital use, a bimanual use of your fingers, a manual use, bilateral, or a circular compression. All of this is going to help you diagnose. This is just showing you the different techniques that you can use. You can either use one digit, like inside the mouth, or bidigital, 2, or you can use bimanual, one on this side and one on that side, or you can use bilateral, both sides, or circular compression. Now, lymph node worksheet. This lymph node worksheet is actually pointing out to you where the different lymph nodes are located in the head and neck area. The most important ones have been listed over here, but there are really tiny, tiny lymph nodes, even under the muscles, that are all connected with the lymph channel. Let's look at the first lymph node right there. This is the parotid lymph nodes. Under the parotid salivary gland, you have lymph nodes right there. And you can see that they are connected with the rest through a channel. So, if a patient has cancer in one lymph node, it easily spreads through lymph to the other channels. That's why it's very important to prevent lymphatic spread of cancer. Now, you also want to make sure that you are checking under this area here is called the mentum. Under the mentum, you have the submental lymph nodes. Here is the mandible. Right under here is the submandibular lymph nodes. So you can see in the picture right there, submental lymph glands, submandibular lymph glands. This here is called the clavicle or the collarbone. Right above, if you do this and touch inside here, you can feel the supraclavicular lymph nodes or lymph nodes above the clavicle right here. Right here is your occiput. If you feel right under here, you can feel the occipital lymph nodes. Under the sternocleidomastoid muscle, which is your main neck muscle, you have other lymph nodes located called the cervical lymph nodes as shown in the picture. And some of these lymph nodes are above the surface and some of them are below the surface of the muscle. So you want to make sure that you're really getting in deep. Now the lymph node chain, like I said, you can have lymph nodes that are superficial or you can have deep lymph nodes. And you can also have lymph nodes right here called the occipital. This is your auricle or the ear. or preauricular lymph nodes right in front of the ear. All of these are connected through the lymph channels. You also want to check, make the patient bend their head down when you want to check for the submandibular and submental, because it's easier to look for the nodes like that. Or you want the patient to bend their neck on this side when you're checking the sternocleidomastoid muscle or the cervical lymph nodes are best checked this way. This is a picture just showing you the location of the different nodes. You can see the parotid nodes, you can see the sublingual gland. Under the tongue, you have the sublingual nodes, and you also have the submandibular nodes. This is just showing you the different positions of the different glands that are located in your mouth. So you have the sublingual gland. Oftentimes you'll see the squirt that comes under the tongue. That's from your sublingual salivary gland. And you have your parotid gland right here. Right over here is your submandibular gland that also produces saliva. Under the submandibular gland or along the gland, you have the submandibular lymph nodes. You have the submental lymph nodes right here. You have the parotid lymph nodes right here. The preauricular lymph nodes right here. This is called the occipital lymph nodes right here, and these lymph nodes in the neck are called the cervical lymph node chain. Above your shoulder blade, your collarbone is called your supraclavicular lymph node. Supra means above. So that's your entire lymph node chain. The other thing you also want to look for, you can see the girl in the picture, her submental lymph nodes are swollen. You also want to look for the thyroid gland. The thyroid gland is found right here in the neck area on either side of the trachea. What you also want to see is the patient has to sit upright and have the patient swallow. When the patient swallows, you can actually see the thyroid gland. You want to make sure that they're using your fingers bidigitally. Also, you want to use circular motion to actually feel the thyroid gland. The thyroid gland also can get cancerous, and there are 4 small glands sitting on top of the thyroid gland called the parathyroids. So this picture is just showing you exactly the location of the thyroid gland in the neck and what does it look like when it's swollen. Parotid glands, like I mentioned to you, the parotid glands are situated right here in front of the ear. Oftentimes you'll see when you're doing a filling, a patient squirts right above the upper molar. That gland is called the parotid gland. Now, we often use a dry angle to block the parotid gland. The parotid gland can get inflamed sometimes from infection or blocked with a stone, or it can also get cancerous like anything else. So you want to make sure you understand where the parotid gland is. You want to look either side to see if there's any abnormal swelling. You want to ask the patient to swallow. You want to check for the squirting, and you want to check if the patient's having any abnormal pain. Sometimes the patient will say, my mouth is really dry and I don't have any saliva coming out. That is giving you a little hint that the glands are blocked. As I mentioned to you, this is the clavicle or your collarbone. The lymph nodes that are sitting in here, you want the patient to do this, and that's the best way to check these lymph nodes. And you want to use the fingers of both the hands like shown in the picture. That's how you check for supraclavicular lymph nodes above the clavicle or the collarbone. Because all these lymph nodes are connected, sometimes you can miss one here or there, but you can catch it somewhere else because the infection is carried by the lymph through the lymph channel. I hope you enjoyed this lecture. Have a lovely day, and we're looking forward to seeing you on Zoom tomorrow with your questions. Goodbye.